dispatched to a poolside to take a worker to the nearest hospital to you for treatment. After the dispatcher told you they found the patient semi-conscious at the poolside. 84-year-old male was seen lying in the supine position, responding only to painful stimuli. During your primary assessment, you find a respiration of 8 breaths per minute, pulse 120 beats per minute, pupil unequal and sluggish, skin cool and clammy. How would you treat this patient?
Good afternoon. EMT Fargis from the Nigel Fire Station. With me, you have Sergeant Wainwright and Corporal Kelly. They're my assistant. Now, scene safety. DSI, ensure that I have on the proper gears along with my partners. MOI, geriatric, found semi-conscious, diabetic, and motionless. Number of patient 1. Based on my MOI, I'm going to consider ALS and also C-spine mobilization. Now, general impression, you have geriatric male, lying supine, appear motionless. Now, I'm going to approach the patient in line of vision, checking LOC. Sir, if you can hear me, please do not move your head. I am EMT Farkis with me, I have my partner. Mr. Kelly, please come manually stabilize PTC spine for me. Now I'm going to check LOC. Patient do not respond to verbal stimuli, so I'm going to use my pen and squeeze patient male bed. Patient groan. Patient responds to painful stimuli. I'm going to ask my partner, Mr. Kelly, to use the jaw thrust maneuver to open patient airway.
Airway open.
Airway open. I'm looking for any form of foreign object, any blood, vomitus, dentures. Patient airway is patent. Now I'm going to look, listen and feel. See rise and fall of the chest and also feel breath. I'm going to check my respiration rate. 30 times 2. Checking for patient is breathing 8 breaths per minute. I'm going to ask my partner to just check the patient O2 sat for me with the sat machine and pass me the slits.
Sat is 80.
Alright, the patient sat is 80. So I'm going to place this patient on supplementary oxygen, 50 liters per minute by non-rebreather. But before I do that, I'm going to auscultate, checking for lung sound, any abnormal sound. The apex, 1 inch, 2 inch below the clavicle. 3 intercostal space, mid-lobe, and the base. Patient airway is clear in all field. Now I'm going to place patient on the O2. Now I'm going to go into my circulation, checking temperature. Patient is cool and clammy. Checking the mucous membrane, tail and dry, lip, tail and dry, cyanosis and no cyanosis, tail and dry. Now, no dehydration. Checking the radial pulse bilaterally, strong and bounding. Checking the pulse rate, 30 times 2, I get 128 beats per minute. Now I'm going to go ahead now and do my rapid scan, checking for any pertinent injury that may cause further damage to the patient. So I'm going to expose upper extremity, checking the neck for BTLS, checking for BTLS. I'm going to use the pupil gauge to check the patient eye for any raccoon eye or any. Okay, I'm right here. Patient eye is unequal. Checking the occipital region of patient head. I feel a swelling. Patient have a hematoma to the occipital region. The parietal region is okay. The mandible and the axillary is okay. The nose, checking for spinal fluid, no spinal fluid. Checking for trachea deviation, no trachea deviation. Jugular vein distension, no jugular vein distension. So I'm going to ask my partner to pass me the C color. I'm going to secure patient C spine with a C color. Alright, continue checking for decap BTLS, checking the clavicles, checking the ribs cage for any fracture, palpate the quadrant, the four quadrant, up and lower for any tenderness, rigidity, or any laceration, checking patient hip for any decap BTLS, in and down, no decap BTLS, checking upper extremity, no decap BTLS, checking lower extremity. I observe a fracture to patient right ankle. So I'm going to ask my partner to bring the splint and the
No.
Before I splint patient extremity, I'm going to check in for PMS and both leg bilateral. There's a pulse present, but based on the fact that patient is semi-conscious, I'm unable to check for motor function and sensation. After I secure splint, I'm going to check for PMS again. PMS present. Check the next extremity for decap BTLS. No decap BTLS. Now I'm going to go ahead now and lab roll this patient. I'm going to prioritize this patient as a priority 1, the load and go, and also treat it for shock. Inside the ambulance, I'm going to put a blanket on the patient to maintain his body temperature. I'm going to lab roll the patient on the uninjured side.
After my count,
And the count
after 3. 1, 2, 3.
Checking the back for decap BTLS. No decap BTLS. So I'm gonna just place patient on the spine board. And the count
After
of 3.
1, 2, 3. Down and up. Up, down.
Now that patient is on the spine board, I'm going to secure C-spine with the head blocks. Secure the torso, secure the mid area first, then the chest, then the lower extremity. Okay. Alright. Now that my patient is secure, I'm going to take my patient to the back of the ambulance, where I'm going to do a sample history from a family member and also a full set of my secondary assessment. We are going to do a full set of vitals. Now, having the relative beside me, I'm going to do a sample history. Given that the patient is semi-conscious, I'm going to unable to get an OPQRS. So, do you know if the patient have any form of allergies?
No.
No allergies?
No allergy.
Do you know if you have any medication?
Yes, he's have medication, but he has not been compliant for the last 6 months. He has not taken that.
For the last 6 months. Okay.
Not compliant.
What is past medical history like?
Diabetes. Have a history of diabetes.
Diabetes? And what was the last thing he ate before?
Presently we are not sure.
You're not sure. And can you remember the time when this happened?
For that we are not sure also.
And what is his name? Mr. Lee?
Mr. Riley.
Roy Lee.
Riley.
Okay. Alright. Now that I done my sample history, I'm gonna go ahead now and do my full set of vitals. I'm gonna ask my partner, Mr. Wainwright, to do a RBG. Mr. Kelly to do RBG. And I'm gonna go ahead and do my other set of vitals. I'm going to check my NOC, check if the patient regain any form of consciousness. Sir? Still no response. Patient respond to verbal stimuli. Painful stimuli. Patient respond to painful stimuli. Now, I'm going to do a GCS fine. A GCS reading of this patient.
Patient G's, RBG is 2.11 millimoles per liter.
I'm going to check patient O2 sat. O2 sat increase to 94%. Check back respiration. 30 times 2. Patient is still breathing shallow at 8 breaths per minute. Checking mucous membrane as well. Still pale and dry. Skin still cool and clammy. Checking bilateral pulse. Still strong and bounding bilaterally at a rate of 128 beats per minute. Patient still not. Patient skin is moist. Now I'm going to do my blood pressure. Patient BP is 130. over 80. Now, given that this patient is a priority 1 patient, I'm going to reassess this patient every 5 seconds during transportation, every 5 minutes, every 5 minutes during transportation, and now that I arrive at the hospital, I'm going to hand over my patient. Good afternoon, nurse. Wainwright. We get a call that geriatric male patient was seen and poolside appear motionless. When we arrived and did our assessment, we observed that PT was breathing 8 breaths per minute, O2 was 80%. Also, he had unequal eyes and a hematoma to occipital region of head and a fracture to right ankle. Now we administer O2 and it improved to 98. Other information is in the patient report. Thank you very much.